My name is Ibrahim Fatima Tejumola. I'm a student of University of Lagos, Social Science Department, Early Childhood Education. So we are here in Wire Market. I'm here in Wire Market asking women, mothers, questions about their children health, community and family at large. Come with me as I ask people questions. Thank you. Good morning, ma. How are you doing, ma? What's your name, ma?
My name is Mrs. Sinkiruka Madubuko.
Okay, nice to meet you, ma. My question is based on what are the ways we can prevent the spread of HIV and AIDS in our community, among families? How do we prevent it from spreading among, even from parents' transmission to children? How do we prevent it, ma?
Okay, to me, concerning the HIV, I think that we need to, first of all, know our status. So those that have it already, I understand. So when they know it, I think they will be taking their medication. Make sure they go to hospital, then identify with the hospitals. Then make sure that they are taking their drugs the way they describe it for them. Then secondly, because they know already they have it, they should, whenever they want to go to public facilities, maybe like going to have their haircuts, I think they should go with their own, because already they know what their status of life is all about. So whenever they want to use public facilities, kind of making hair, barbering salon, or their nails and other things, or even the hospital, or I think they should have their own privately, so that when they finish using it, they can keep it for themselves. Then again, concerning their families, I think their families need to be aware that they have such things, because there's some of them will hide it. They won't like their family to be aware, because because of is it discrimination, something like that. Yes, because some people, because of that, so they won't like their family to be aware. But I think is they are not doing their family well. They need to make their family to be aware, so that when whenever they want to use the sharp objects, as I understand, they will not, it will be specified, or they will even avoid it, or whenever they are doing something like that, they will be very careful about that, because I believe that, I know with experience that contacting HIV is through blood transfusion. Then concerning the baby and the child, I think in the hospital, there is a way of the or when you're going for your maternity antenatal, I mean, there is a drugs and everything on there. So I think they will, yes, there is a, because I think I have a friend that was fortunate to be a HIV, but he has 4 children now, and none of the children contacted it, because she was able to identify on time, explain to them, so they tell her what to do, and she stick very well on those instructions given to her. So there is a way in a hospital for them to make it. So there's some drugs, and so that you can be able to, it will not. Then I think when you gave that, when you as you have your baby, yes, I think there will not be breastfeeding. I think that is, yes, will not breastfeed the child. You will not breastfeed the child. So because breastfeeding the child definitely the child will contact. So there is nothing like breastfeeding. So you will not breastfeed the child. You just use formula and other things to take care of the child. I think that is all I know about the. Then concerning the malaria and the
Malaria prevention.
yes, I think first of all we need to keep our environment clean. When we clean our environment, our areas need to be clean to avoid all these mosquitoes and all these things so, and the things we are using, they need to be clean. Then once in a while we need to maybe fumigate our areas. I think it will reduce those things. Then once in a while we need to especially clean water. Although in Nigeria I don't know how many clean water that we have, so but I think clean water also. Then the food that we eat, to understand. Now they're advising us to eat more of vegetables. I don't understand. Those things help. We need to check the foods that we eat. It's not anything that come across that we have been taking. Fruits, vegetables, and so I think those things help to then check our hormone system. Okay, those things will help to boost our hormone system. Yes. So it will not make those small
And even
malarias
the
and
use of treated mosquito nets.
yes, those ones go a long way. Okay,
Yes.
but some people are saying that treated mosquito net is not okay at times. I've had one training like that. They condemned it. So, but I don't know because of they say that some people are not using it. So because of the at times there's some you will get it will have that kind of chemicals. Do you understand? So when you are inside, so understand some suffocate inside. So I think experience has so.
Yes,
But I think the
ma'am.
best thing is that just make sure that your environment is okay. So understand. Keep all the remove those things that will bring more mosquitoes and other things. Then eat well. That is the most important thing again. Eat well. So I think that was
Thank you very much, ma'am.